Well, May is Stroke Awareness Month, and right here close to home at St. Rita's, we have good stroke care, intensive close care to us. So joining us today, we have Dr. Shade, and he's an interventional neurologist, and he's going to tell us more about the stroke care at St. Rita's. So thanks for coming today.
Thank you for having me.
Okay, so May is Stroke Awareness Month. So to make us aware, what are the symptoms? How do we know that we're possibly having a stroke?
So stroke is a very serious disease, first of all. It's the #1 cause for disability in the U.S.
Okay.
And it is the third leading cause for death. So it's very important to know what are the symptoms and signs for stroke, because now stroke is very treatable disease and very reversible if the patient get to our attention on time. So the stroke symptoms is summarized by the acronym FAST. So F stands for face. So if there's any face weakness or numbness, that could be a sign of a serious stroke. And then A stands for arm and leg, actually. And if there's any arm or leg in one side or another weakness or numbness, that could be a sign of stroke. And then S stands for speech. So if there's any speech problem, either slurred speech or inability to understand speech or produce speech, that could be also a sign of stroke. And T stands for time to call 911, and also stands for terrible headache, which is, this is another sign of different type of stroke, which we call it the bleeding type of the stroke. And that's the time to call 911 and get to the hospital.
Okay, so I assume no matter what, it's best to call 911 and use the ambulance to get there instead of driving yourself?
Correct.
Okay, because time matters, right?
Correct. So with the acute ischemic stroke, the moment the stroke started, there is 2 million brain cells die every minute. So, and you can imagine if you lose 2 million neurons, that will make a huge difference in the residual brain function. And that's why you need to call 911 right away and get to the hospital.
All right. Now, you mentioned that there is help for us. So we have the Comprehensive Stroke Center here at St. Rita's. So what kind of things can you guys do to help people who are having strokes?
So the Comprehensive Stroke Center means we have all the equipment, all the expertise to treat any type of ischemic stroke or hemorrhagic stroke 24/7, and all the resources are readily available throughout the day and the night, and no difference if you come in the morning or at midnight or early morning. We are available 24/7. Most important type of treatment we offer is the stroke intervention. We call it intra-arterial thrombectomy. That's in addition to the medical treatment, which we use the clot buster medication.
Okay.
So being Comprehensive Stroke Center mean we are able to provide the medical and interventional treatment 24/7 immediately. And also there's a lot of other interventional procedures that we offer for different cerebrovascular diseases that are equally serious and fatal.
And I assume then that makes a difference for the patient, that they can recover, they can get some things back maybe that they've lost through the stroke?
Correct. So the moment the stroke starts, the clock starts ticking on the brain. This means when the clot block brain vessels, what we call the wave of death start to spread from the center of the brain to the periphery. And if we don't take the clot out, that wave of death of brain cells continue to spread until it eats the entire territory that is supplied by that vessel. And our role here to take the clot out, stop the death wave from spreading. Not only that, but also give a chance for those areas that already stroked to recover and reverse the damage if it's done within the time window for that.
Okay, and we have an image that you wanted to show. And
yes.
Let's pull it up on the screen because you can tell the difference, and you'll explain how we tell the difference. So on the left, we're seeing...
Correct. So on the left, you see that there is a major vessel that is compromised because there's a clot there, not allowing the blood to flow to the entire that side of the brain. And on the right side, you see how the flow really going to the entire that side of the hemisphere and reperfusing the brain.
Right, that is a big difference to see more red lines or whatever, more of those lines going through, and that's the blood.
Correct.
Wow, all right, so that is an example of how you can make a difference, and that's why time matters.
And those procedures are relatively safe and quick.
All right, very good news.
Yeah. But I want to emphasize here that I cannot help my patient if they don't get on time and be in the time window for those treatments.
Right, yeah, that's the point. Get there fast. Great treatment that we have in our area. Thanks, doctor, for coming today and
Thank
telling
you
us
very
about
much.
it. May is Stroke Awareness Month. All right, don't go away. New Tradition continues in a moment.